Hello and good morning, everybody. And today we're going to talk a little bit more about this Canada or Candida auris virus. It's a fungus virus, and it's going around. And even Chuck Schumer's gotten on the bandwagon now. So let's go and listen to see what Chuck Schumer has to say. But I just want to say, I know people that work in hospitals, and I don't know why the CDC has put out a report, and I'm going to have that after Chuck Schumer talks about it. But I don't know why they're not telling the employees of the hospitals and emergency rooms and whatever about this virus, because it's bad. It's very bad. And listen to Chuck right now. Play cut 1, Chuck Schumer.
It's a fungus, a superbug. It's called Candida auris. It looks spooky, and it is. It's a fungus that has no cure. It's resistant. As this map shows, New York is #1 with 319 cases. And because this bug is so deadly, and because there's no cure, we have to act, and we have to act fast. We've had 319 cases already reported in New York, and there's likely to be another 4 added very soon. The Center for Disease Control, which is not prone to exaggeration, calls this a serious global health threat. Aside from the inability to be treated, this superbug is a particular concern because of the way it spreads. So you're a younger person, you go visit your elderly parent, you might have no symptoms, not know you have it, and yet you can give it to them. We're here today to urge the CDC, the Center for Disease Control, to deliver a whole bunch of resources that can help New York and other states kill this bug and stop its spread.
Now that was Chuck Schumer, and I'm not an alarmist, and he's not either. But one thing I want to let you know is Instagram, YouTube, and different places, when we put up these videos, they take them down or block them from people seeing them, and I don't know why they are doing that. It is very difficult to find a video about what's going on, and a bunch of them are clickbait. You click on them and all it is a video that says it's coming up soon, and just keeps playing commercial after commercial, and that's what I'm trying not to do. And so now let's listen to the CDC, because as Chuck Schumer just said, the CDC is not an alarmist, but they have put out some very strong words about this Candida Auris Fungus. So let's listen to the CDC right now. That would be clip 2, CDC.
Hello, I'm Dr. Tom Chiller, Chief of the Mycotic Diseases Branch here at the Centers for Disease Control and Prevention. As part of the CDC Expert Commentary Series on Medscape, I would like to tell you about Candida auris, a novel yeast that is behaving in unexplained and concerning ways, causing severe disease in countries across the globe, including here in the United States. Today, we'll share how you can protect your patients from this potentially deadly infection, the history of this unusual bug, and how the U.S. is working with global partners to combat its spread. There are several features that set Candida auris apart from other Candida species and make it a particular concern. First and foremost, Candida auris can spread between patients in healthcare facilities and cause outbreaks. In this way, it appears to behave much more like some multi-drug resistant bacteria like MRSA or Acinetobacter. Using contact precautions to prevent transmission may sound strange for Candida, but for Candida auris, they are a key part of the control strategy. Number 2, Candida auris can colonize patients' skin for months or longer. It can be readily detected by culturing swabs of colonized patients' axilla, groin, or other body sites. In light of this, use of contact precautions as well as strict attention to hand hygiene are critical elements in controlling spread. CDC is also working with partners to better understand the role of topical agents to help prevent spread by reducing colonization. Number 3, this hardy yeast can live on surfaces for a month or more, and preliminary testing suggests that quaternary ammonia compounds, commonly used for healthcare disinfectants, may not be sufficiently effective against Candida auris. Until further testing is available, CDC recommends that healthcare facilities meticulously perform daily and terminal cleans of rooms of patients infected or colonized with Candida auris with an EPA-registered disinfectant that is effective against Clostridium difficile spores. Number 4, Candida auris is quickly becoming more common. In some international healthcare facilities, it has gone from an unknown pathogen to cause of 40% of invasive infections within a span of just a few years. We need to act now to prevent this from happening in the U.S. Number 5, Candida auris is often multi-drug resistant. Some strains have been resistant to all 3 major antifungal classes, including the echinocandins, the first-line treatment for Candida infections. Number 6, Candida auris has never been reported to have been isolated from the natural environment. And it does not seem to have been common colonizer of humans before 2009. More research is needed to understand where in the environment Candida auris lives and why it began affecting humans only recently. CDC's website has the most up-to-date guidance on identifying, treating, and controlling the spread of Candida auris in healthcare facilities, including nursing homes and outpatient settings. The key measures are to, number 1, place patients in a single room and use standard and contact precautions. Number 2, emphasize adherence to hand hygiene, including use of alcohol-based hand rubs. 3, clean the patient care environment with recommended disinfectants. And 4, screen patients to identify Candida auris colonization and report suspected cases to local public health authorities and CDC immediately for guidance. Candida auris can be misidentified using traditional methods. CDC and the antibiotic-resistant regional laboratories can assist with identification and characterization. As background, Candida species are an important cause of healthcare-associated bloodstream infections in the United States and internationally. Most invasive Candida infections are thought to result from auto-infection with the host's own yeast flora during microbiome disruption. For example, from broad-spectrum antibiotic therapy or from an invasive device like a central line. Accordingly, outbreaks of Candida infection have been rare, since little evidence of transmission existed. Of the more than 400 named Candida species, only a few dozen regularly cause human infection. In 2009, this new Candida species, called Candida auris, was reported, having been isolated from the ear canal of a woman in Japan. By 2016, Candida auris had been identified in several other countries in various regions of the world. To understand how it spread quickly, CDC worked with partners in several countries to gather Candida auris isolates and test them by whole genome sequencing. The results were surprising and puzzling. A single strain of Candida auris was not spreading around the world, nor were many unrelated strains suddenly being recognized. Instead, isolates fell into 4 distinct clades or groups along geographic lines. It appeared that distinct strains had emerged nearly simultaneously in 4 different regions of the world. Changes in the environment may have led to its emergence, followed by subsequent transmission in healthcare settings. Cases in the United States were soon identified. Retrospective reviews of hospital microbiology records found very few cases identified before 2016, suggesting that Candida auris is still new in the U.S. CDC worked closely with health departments and healthcare facilities to respond to the first cases, learning more about how the organism spread and how to stop it. Cases had occurred primarily in people with extensive healthcare exposure, including those in long-term care facilities. Visit CDC's website on Candida auris for updated case counts and locations. Thank you for watching. Together, we can control the spread of this new and concerning pathogen.
Okay, so there you have it from the CDC, this new and concerned pathogen. It's very important, people, but you need to share this video, let people know, use some good hand sanitizer when you're going out and around, and keep your hands washed and cleaned, and just be aware. And I'm going to put several links below the video on different articles about this, so you can research it and look at it yourself, and the CDC's website. But I'm telling you, it is hard to find video and commentary on this. It's not being reported in the mainstream news. They're taking down videos when you put them up about it, and I don't know what the secrecy is about it, because people need to know. It's like a meteor coming to hit the earth. Are you going to tell people or not tell people? There's pros and cons to both of those. But anyway, this is Harold with WorldTVOnDemand.com, bringing you a great video. Please give me a thumbs up, subscribe to the channel, and if you want to subscribe, you can subscribe through YouTube, or you can subscribe through the little bar logo, and support the channel. I appreciate it. You guys have a fantastic day, and I'll have another video for you soon. This is Harold signing off, baby. See you later.